Hi guys, can you hear me?
I can hear you, please.
Okay. Good evening, everyone. Hope you are all okay. So today we're looking at pharmacology. Okay. The materials that were made available in the classroom. So I'm hoping we actually went through it, right? I'm hoping we went through the materials that were provided for this our presentation today. Let me share my screen so that we can actually have a view. Yeah. Can we all see my screen? Guys, can we see my screen?
Yes,
The presentation. Okay. So we'll be looking at the pharmacology. We'll have a run through on the course. We just have a run through from the introduction, looking at pharmacokinetics, pharmacodynamics, how the medication gets into the body, its various routes, right, through its target organs and elimination. And after that, we have to look at some safety regulations or safety key aspects when handling medications. And furthermore, we'll look on high alert medications, like what to look for when administering high alert medications and the safety precautions to bear in mind. Okay. I'm having some troubles. Let me try and share my screen. You guys can better see. Okay, share this one. Yeah. Can we all see now clearly? The navigation. Can we follow as I'm navigating? Is it visible?
Yes.
Okay. So, like I said, we'll start from routes of administration, right? Right up to elimination and safety aspects in medication administration, in high alert medication administration. So now let's first of all go through the routes of administration. We know in medication administration, the IV route, it is the fastest route of administration because the medication is being introduced directly to the bloodstream, right? So it does not have to go through absorption from the stomach before distribution again or going through the liver, right? So it goes straight to the bloodstream where it's being carried out, it's being carried to the target site. After the IV route, we have the oral route. The oral route, it's usually slow because you have to go through the GI tract, digestion, and you have to pass through the liver. And with the liver, it will undergo the first pass effects, where the medication is being broken down and the bioavailability is being reduced before it reaches systemic circulation and is being carried to the target site. After that, you have the enteric coated tablets. And we know these are specially designed for absorptions in the less acidic environments, like the intestines, right? So we should bear in mind that we are never supposed to crush enteric coated tablets. Why? Can someone give us a reason why we are not supposed to crush encoded tablets and capsules? Guys, are we following?
Yes, we are following.
I'm asking if someone can give us a reason why you're not supposed to crush encoded tablets or capsules. Why we are not supposed to crush them before administration. When you crush enteric coated tablets, you destroy the coating already. The protective coating that hinders interaction with or interaction in the stomach or absorption in the stomach, right? So it causes a problem. That's why they are being coated. So once you take them, it goes to the stomach. It's not being broken down in the stomach directly. Okay, like he said, the coating is designed to delay absorption until it reaches less acidic environment like the intestines. So if you destroy the coating, that will be a problem. So aside from the route of administration, there are two factors that influence the drug absorption, the rate of drug absorption. And one of them, we have blood flow to the site. We know highly vascularized sites, they enhance drug absorption, right? Like sublingual tablets, they're easily absorbed because beneath your tongue is highly vascularized, right? And let's say your intestines, you have the highly vascularized villi or microvilli that are there. So the drug is easily taken, right, from the intestine, it's easily absorbed from there and transported to its target organs. So the availability of blood flow is actually essential, and it's very important in the drug absorption or flow to the site. So another factor we have is medication form. So like the physical form of medications, like the enteric coded tablets, like we said earlier, they are being designed to delay breakdown and absorption. So they can only be broken down or absorbed in specific parts of the GI tract. Now we look at metabolism, how the body processes the medications. So with this, we know the chief site where metabolism or breakdown medication detoxifying takes place is in the liver, right? So during medication administration, we need to pay attention to the liver. If the patient has a liver damage or has a problem like liver cirrhosis, this will delay or slows down absorption, leading to buildup of medication in the body, buildup of the amount of medication in the body, causing toxicity. So we are supposed to always pay attention to the liver function of the patient while administering medication. Okay. Now looking at the half-life, right? We are still talking about the pharmacokinetics. Can someone help us differentiate between pharmacokinetics and pharmacodynamics? The difference between pharmacokinetics and pharmacodynamics. Guys? So with pharmacokinetics, this is how medication gets into the body, transported, and it's being eliminated. Okay? And the pharmacodynamics, this is how the medication exerts its effects on its target organs for us to see the desired effect, the desired outcomes. Right? So still looking at the pharmacokinetics, let's look at half-life. The half-life of a medication, it simply means like the time it takes for 50% of the drug to be eliminated, to be broken down and eliminated from the body. With this aspect, it helps in understanding how to dose a medication. Like if after 2 hours, 50% of the, if a medication has a half-life of 2 hours, it means after 2 hours, half of that medication is being eliminated from the body. So we know when to up the dose to maintain a stable therapeutic rate, right? Guys, are we together?
Yes.
Can someone help us with the significance of understanding the half-life of a medication? What is the importance of knowing the half-life of a medication? Like I just said, the half-life, right? It's the time it takes for 50% of the drug to be eliminated from the body. So it helps in the dosing, right? So if the half-life of a medication is 2 hours or 4 hours, that's why we have medication given every after 2 hours, every after 4 hours, every after 8 hours, or 16 hours, right? This is an important aspect because of the half-life. So if it takes 2 hours or 4 hours to eliminate half of this medication from the body, now we have to reintroduce or give another dose to up or maintain the therapeutic effect of that medication in the blood, like in the body. Correct? So after administration, route of administration and movement of the body, movement of medications in the body, we should take a look at intended and unintended effects of medications, some medications. So we all understand that medication administration, it's when you administer a medication, it's supposed to exert its desired effects to which it's being administered. But at some point, you have some unintended effects, which can be harmless, some can be harmful, and very dangerous when the dose of the medication accumulates in the body. Okay, like the side effects. You have side effects, you have adverse effects, and you have toxic effects of medications. Can we get the difference between the side effects, the adverse effects, and the toxic effects of medication? The difference between these three statements, the toxic effects, side effects, and adverse effects. Can someone help us here? Guys, are we together?
Yes.
Yeah. What do we understand by the side effect of a medication, the medication side effects?
The I don't know if I can use the word harm. The harm that comes after taking that medication. That's the side effect.
And then adverse effects. What do you understand by adverse effects if the side effect actually causes harm? We should know side effects and adverse effects. They are two different things, right? So side effects are often like expected secondary effects of medications in the body on a normal dose. When you pick up a medication, like you're reading the labels, you see side effects like nausea, vomiting, right? Like nausea, those are like side effects, correct? We're talking about adverse effects. Now they are harmful, okay? They are harmful undesirable effects of medications that are being administered on a normal dose. Let's take, for example, let's see. Yeah, let's just see ACE inhibitors, captopril. Okay, who can give us an example of a side effect of captopril and an adverse effect of an ACE inhibitor, ACE inhibitors? The side effect of ACE inhibitors.
Sorry, here is noise. The side effects of captopril is dry persistent cough. There should be dizziness. There should be low blood pressure or weaknesses.
Yeah, like you said, exactly. Dizziness. You have cough, dizziness. Those are side effects, right? They are expected to occur when you administer the medication. But now, adverse effects like harmful effects. You have like angioedema, right? Swelling of the tongue, face. With the swelling of the tongue, it can lead to what? Airway obstruction, which is a very fatal event and it's very dangerous, right? So we can see a medication like that, it has its side effects and the adverse effects. And then now looking at the toxic effects. So with toxic effects, it's directly linked to the dose of the medication that's been administered. So a medication administered at a dose that the body cannot clear or a dose that's not appropriate for the body, it accumulates and it becomes toxic, right? And like an example of, let's say, the toxic effects of a medication, you have, let's say, digoxin, the cardiac glycoside. Can someone help us with the toxic effects of digoxin? So with digoxin, once it reaches toxic doses, you start getting complaints from the patients like seeing yellow halo lights, yellow halos around lights, right? Those are indications of toxicity. So this is just it. Yeah, like I said, you have some critical signs of adverse effects to watch for in medications. And these are some of the medications that are just being listed here. We have opioids, and with these things, opioid analgesics, they are central nervous system depressants. When administering them, we need to watch for what? Respiratory depression, right? You need to always assess the respiration. Watch for slow, shallow breath. In case of overdose, right, it becomes a big problem. Like I said earlier, you have digoxin as well. And the key sign of toxicity, you have visual changes, like a patient report seeing yellow halos around light. Another, we have the ACE inhibitors, like I said. So we watch for angioedema, which is the rapid swelling of the lips and face, tongue as well. This is a serious allergic reaction to the medication, which is life-threatening. So another, we have like the normal antibiotics. Antibiotics, they cause anaphylactic reactions, right? Which you have symptoms associated with like wheezing, shortness of breath, which are prominent or can lead to airway obstructions and hypoxia. So another medication you have here is warfarin, right? The anticoagulant. So you need to also watch for signs of bleeding, like black tarry stools, coffee ground emesis, right? Bruising in the mouth, unusual bleeding. Okay. So now let's take a look at the golden rules of safe medication administration. So with medication administration, we need to understand that there are some checklists, safety checklists that we need to always adhere to or pay close attention to when administering the medication. And one of them is you verify the order, right? If a medication's order is not complete or you don't understand it, you re-verify with the provider. You don't assume or think on your own. If there's something you don't understand, if you don't understand the dosing, you don't understand the route, you re-verify. Or if it's written in language you don't understand, or there's like a short form of it you don't understand, you re-verify the order before you proceed. Another, we have the use of two patients identifiers. So with administering medications, you make sure you use the two patient identifiers like date of birth, right? The name and date of birth. Check them with the medication administration record. If they match, then you can proceed with medication administration. You can administer to the patient. Okay. Another third factor of looking at, like you double check high alert medications. With high alert medications, you double check them with another staff independently, like a nurse. You ask them to check independently as well. If everything matches, like the order matches the patient and the dose, everything matches before you proceed to administration. So now you assess the patient, right? Before administering the medication, you assess the patient. Like before administering antihypertensive medications, you assess the blood pressure. Okay. Another high alert medications, like we said earlier, the digoxin. Before administering that, you assess the patient by counting the apical pulse, right? If the pulse is less than 60 per minute, you do not administer the medication. You hold it and you alert the provider, right? Correct? Now let's look at patient-centered safety. Responding and professionalism. Like, how do you handle medication administration with patients and responding professionally? So during administration, you might be asked a question, or a patient might refuse the medication you're administering. What do you do in that aspect? First, you have to respect the patient's autonomy. The patient has the right to refuse or deny treatment. So what do? You respect the patient's autonomy, you document, right? You document the refusal and then you inform the provider. In that order, you respect, right? You document and you inform. And the next thing too, if a patient asks you a question or says something like the medication you're offering them, it's it's not something they are used to, or it's different from what they have been taking, you don't just ignore them and carry on. You stop, you recheck the order, and you verify with the pharmacy if necessary. Then you continue. If it's not, you report to the provider. Okay. Now, looking at all those aspects, if unfortunately we still encounter an error like a medication error, what do you do? If an error occurred or you discover a medication error, you assess and monitor the patient for adverse effects. If a wrong medication is being administered, or a wrong dose, or a wrong route, like we record the 5 hours of medication administration, right? So if you miss one step or there's a mistake in one, you stop, you assess and monitor the patient for adverse effects, and you notify the provider. And after that, what do? You write an incident report, you complete the incident report. Okay? And the incident report should contain the details of the error, right? The patient's assessment findings, if everything was okay after administration, or the patient was deteriorating, you include all that in the report. So this will help, it will help improve safety in medication and practice for other upcoming nurses already. Okay. Guys, are we following? Are we together?
Yes, please.
Yes, we are.
Okay. So we have just had a run through on that. Now we'll just take a look at some high alert medications that we have to pay attention to during administration or even after administration. Let's take some, yeah. So with the high alert medications, these are like drugs that they pose a very high risk in causing significant patient harm, right? If an error occurs during administration, right? So when administering this medication, we need to adhere to the principle of medication safety and handling, right? We should never deter from it. So we should have a run through. I mean, we talked about core principles of medication safety just in the previous slide. So we just have to get a glance or run through of it again here, so we can actually understand it and it sticks with us. We said already, like when administering high alert medications, right? What do? You double check, right? Double check high alert medications independently with another nurse before administration, correct? Another key safety precaution is you always adhere to the rights of medications administration, right? You always verify consistently. You check if it's the right patient, you check if it's the right drug, you check if it's the right dose, you check if it's the right route, and you check if it's the right time. These are all fundamental nursing knowledge, and it's not supposed to ever be neglected in any aspect or any time. And as well, use the 2 patients identifiers. Like I said earlier, use the 2 patient identifiers like the name of the patient and the date of birth, correct? So you check it matches with the medication administration record before you proceed with medication administration. And like you said again, if there's an order you don't understand, you have the right to question, okay? You question others you don't understand. If there's a route of medication you don't understand, if a medication order states you administer like potassium IV, what do? You stop, because it's universal nursing knowledge that you're never supposed to give potassium by IV push, right? So you stop. You question the order like this. I don't. You question the order like this. I don't understand. From my own understanding or from the what I know, potassium is never supposed to be given IV. So why is it written here like this? You question that. That is you advocating for the safety of your patient. It's your right as a nurse, ethically, right? As a nurse, you have the right to advocate for patients' safety. And we talked about this already in the previous slide, responding to patient incidents like patient refusal, where the patient is autonomous, you respect the patient's decision, you document, and you report to the provider, or you inform the provider. And patient's questions as well. Patient has a question, right? You stop. If a patient has a question about an order or the medication, you stop, you verify, and you explain, right? Or you check with the pharmacy. And as well, in the case of discovering an error in medication administration, we looked at we had a look at it already, saying if there's an error, what do you do? What do we do with when we discover an error in medication administration? Guys, what is the course of action when you discover a medication error?
You assess, then you notify the provider, then you document.
Exactly. Good. So you assess for the adverse effects. If the medication if the error is causing an adverse effect, you assess, right? Check what's the adverse effect, what is happening, right? You notify the provider, right? Then incident report. So we'll take a look at some of the medications, like some of the high risk medications that we are supposed to pay attention to when administration. So you have opioids, analgesics, like the morphines. And we know when administering this medication, you need to monitor what? Respiratory rate, right? You assess the respiratory rate. Why do you assess that? As simple as it is here. To establish a baseline and detect opioid-induced respiratory depression, right? Since it's a central nervous depressant, right? And what are the signs of overdose or toxicity? Since we are assessing for respiratory depression, the signs of toxicity, what would they be? Shallow breathing, right? Respiratory rates of 8 going down, right? So another key assessment in opioid analgesics administration, you have level of consciousness. So this medication is used to treat moderate to severe pain, and it has a sedative effect, right? So during administration, what do? You have to assess for level of consciousness and sedation. Okay. Another key assessment we have is the pain score. Since the medication is given to treat pain, we have to also assess the pain score. If the medication is providing like its desired effects, like it's relieving the pain, good. If it's not relieving the pain, then we know either the patient has developed resistance or to the medication, either the patient has developed tolerance to the medication, or the dose is not enough to relieve the pain, right? And in case of excessive medication or toxicity, you have sedation, right? Like excessive sedation. So looking at the critical interventions and the side effects, we just looked at this table here. Can someone help us with the side effects of opioids, analgesics? The side effects and toxic effects. Guys, can we have someone help us with the side effects and toxic effects of opioid analgesics?
Respiratory depression.
What would that be? Side effect or toxic effect?
Oh,
Sorry?
please, the question again.
Can someone help us with the side effects and toxic effects of opioid analgesics?
I mentioned respiratory depression, please.
Okay, so is that a side effect or a toxic effect?
I think it's a side effect.
Sorry?
I think the respiratory depression is a side effect.
Respiratory depression will be a toxic effect because it's potentially harmful, right? It's causing immediate harm. You have respiration or like a respiratory rate of 8. You're going into respiratory depression already, right? Leading to hypoxia. That is potential harm already, right?
Yeah.
Yes. Good. So we know since opiate analgesics, they are central nervous system depressants and they slow down a lot of what we say involuntary activities. After taking it, right, a key side effect we often notice is what? Constipation, right? You will notice constipation because of what? Slow gastric motility, right? And in emergency situations, like when you notice the case of respiratory depression with respiratory rate of 8 and below per minute, you know it's a life-threatening situation and requires prompt intervention. So what do? You notify the provider, right? Then you pray for administration of the antidote, which is naloxone. Okay. So let's look at another high-profile medication that requires consistent monitoring during administration. We have anticoagulants, like warfarin and heparin. So, please can you mute your mic? There's someone with the mic on. Thank you. So with the two anticoagulants like warfarin and heparin, can someone actually help us with the difference between these two anticoagulants? The difference between warfarin and heparin. They are all anticoagulants, right?
Let me try. I think the heparin is used for a short period. The warfarin can be used for a long period.
Okay, correct. Correct. Like you said, rightly, heparin is used for short period of time, right? It's mostly given IV or subcutaneously. Okay. And warfarin is always taken orally. Another difference you have is the antidote. Who can recall the antidote of warfarin?
Vitamin K.
Correct, excellent. And that of heparin?
Protamine sulfate.
Excellent, thank you. So during administration or before administration, you need to do your assessment, correct? Like we said, oh, you have to assess the patient before administering the medication, right? The key safety guidelines in administering high-risk medications. Patient assessment was probably one of them. So in assessing your patient, what do you pay attention to? You check if there are any active bleedings or unusual bruisings. These are anticoagulants. If you administer them while there's an active bleeding, there's a risk of hemorrhage already, right? So you assess and check for active bleedings or unusual bleedings. The next is still bleeding gums. You check the amount of the patient. Does the patient have bleeding gums? You check for signs of GI bleeding, like black tarry stools and coffee brown emesis. Okay. So you perform these assessments. These are the assessments you perform before administering a high-risk medications like these anticoagulants. Okay. So let's look at warfarin. Like you earlier said, warfarin it's given orally and it's used long term, and it requires lab monitoring, like the RN ratio. You're supposed to monitor that before administration. And with heparin, what you monitor is the APTT, activated partial thromboplastic time. Okay. So these are the parameters you measure, they measure before administration of these anticoagulants. You ensure patient teaching as well. So with warfarin, you maintain a consistent intake of vitamin K, right, found in green leafy vegetables. Okay. And with heparin, it's like it's stated here, administered via subcute injections, right, into the abdomen at these angles. So looking at warfarin, before administering that, we need to assess if the patient is currently taking medications like aspirin or non-steroidal anti-inflammatory drugs, because this will increase the risk of bleeding. The drug interactions will increase the risk of bleeding. And the antidotes, like you rightly mentioned, you have vitamin K, right? Warfarin and vitamin sulfate or heparin. So another high-risk medications that require monitoring during administration, you have insulin. Okay, so insulin is given to, like we all know, is given to correct the error of glucose metabolism. That's diabetes, right? So it's a high alert medication that if it's not consistently monitored, if you don't monitor the administration, the time, you run the risk of hypoglycemia. You know, hypoglycemia is like one of the primary the primary side effect of, I mean, like over medication is the primary reason for hypoglycemia in diabetic patients. It's funny when you say a diabetic patient is hypoglycemic. It doesn't really make sense logically, right? But then when a diabetic patient over medicates, like huge dose of insulin, or if it's given at the wrong time, there's a risk of hypoglycemia, right? So in administering insulin, we look at the site rotation. You need to educate or reinforce the teaching about site rotation, like frequently change sites of administration, right? And timing as well. Timing is very, very essential for rapid acting insulins like Lispro. We should always take note. The rapid acting insulin like Lispro is supposed to be provided with a meal, right? To prevent hypoglycemia. Okay? So you give it along with the meal. So in case if we encounter a situation of hypoglycemia, how do we expect to manage it? Yes, how will we manage a case of hypoglycemia?
Let me try. I think if the patient is conscious,
You
you
have
give
to focus.
fast acting snack like maybe some fruit juice or ice cream. But I think if the patient is unconscious, maybe you can inject glucagon or give dextrose,
Good, good.
maybe
So if the
50%
patient is
dextrose.
unconscious, yes. If the patient is unconscious, dextrose or glucagon. And if the patient is conscious, right, fast acting, uh, rapidly metabolizable sugar. Okay. So what are the signs of hypoglycemia to watch for? Signs of hypoglycemia.
Sweating.
I think some are
Have sweating,
Sweating. Yes, sweating.
tremors. Good. Sweating, tremors, right? Those are
Yes,
visible
sir.
signs. So with the priority intervention, like you mentioned, fast-acting carbohydrate or rapidly metabolizable sugar. The patient is conscious, and if the patient is unconscious, like said, dextrose or glucagon. Okay. So after looking at insulin, now we take a look at the cardiac glycoside digoxin. I think we made mention of it in our previous slide, right? The cardiac glycoside digoxin. So it is used to treat myocardial contractibility in conditions like heart failure, right? And it has a very narrow therapeutic window of like 0.6 to 1.2. So you can imagine how narrow that window is to make a mistake. Okay. So it needs to be watched or monitored consistently in order to avoid toxicity. Right? So we tell the difference between the therapeutic effects, like therapeutic effect and toxic effect of medications. I think we can tell, right? So like the therapeutic effects, or it's the primary effects which the medication was being administered to, right? The toxic effect is when the medication accumulates and it's causing little harms to the body, right? So with digoxin, it has a very narrow window, right? Of like the therapeutic window, it's 0.6 to 1.2. So it requires close monitoring consistently to like prevent toxicity. Is there something? You have a question? Is there a question? Okay, so we made mention of the fact already that in administering high alert medications, who can recall the steps or the safety precautions or safety guidelines in administering high alert medications like we made mention earlier? What did we say? What did we say there were important things to watch for or do when administering high alert medications?
You have to check. You have to check for vitals before
Good.
administering.
Correct. You assess the patient, right? You assess the patient before administering high alert medications. Another, what do you do? Double check, right? You just made mention of all those important keynotes already. You double check independently with another nurse, right? For administering high alert medications, you assess the patient, check for vitals, right? Pertaining to the medication and the medication administration, right? And then you follow the 5 hours of medication administration, correct? So going along, we should not forget these aspects. They are very, very important, and they are key aspects we use throughout our nursing career. Okay. So in administering a high profile medication like digoxin, what do? You do your assessment, right? Patient assessment. And with the patient assessment, you count for apical pulse, right? And if it's less than 60 beats per minute for adult patient, what do? You withhold the medication and you notify your provider. Is that correct?
Yes.
And a very important note here, since we are nurses, we always have like, we might have multiple patients and we are trying to buy time or something. You should always bear in mind that when counting apical pulse or respiratory rates in pediatric clients, what do? You count for the whole minute. You don't count and multiply, correct? In pediatric clients, you count or assess for the full minute itself. You do not count and you multiply, right? Because with children, you might have gaps in breathing, which will detect the result. So once you have done your assessment, right, and you administer your medication, what do? Now you watch for indicators of efficacy or toxicity. And with indicators of efficacy, you check for why the medication was administered in the first place, if it's achieving its desired effects. Since we know digoxin is a cardiac glycoside and it's being administered to treat myocardial contractibility in conditions like heart failure, right? So if there's an improvement, what do? You check, right? If it's achieving its desired effects, you obviously see, right? Improve activity tolerance. Okay, the patient might be able to walk one or two flights of stairs. Good. Reduce edema, like the heart is pumping well, right? There's recirculation. That's indications of efficacy of the medication. Okay, and in case of toxicity, like we mentioned earlier, the patient will report what? Seeing halos around, like it is a very, very serious complaint. So it requires immediate intervention. So you report to the provider immediately. Okay. So this is the run through of what we had to discuss today on pharmacology. Now we'll take a look at some few questions or some like a quiz. We'll just have a look at the quiz to like test our knowledge of what we have discussed today and like to better cement our understanding. So before we go there, do we have any question right now? You have a question concerning what we just discussed?
I have a question. What we discussed is it in the what can I call it? Or you can get you can send us the what? Whatever we have discussed as a PDF.
Okay. The document is on the classroom, right? This is it in the Google Classroom. Let me see. Here we have it. It's in the Google Classroom. Okay. You see, week 3 pharmacology. We have week 3 study resources. Pharmacology. This is it.
Okay. Thank you.
Okay. So, like I always say, please before we come to class or even after a class, you should always go to the classroom. Right? Go to the classroom, review the materials that are being provided, or you check the materials that we studied. It will do us no harm to like recheck again, right? So let's look at the quiz just to test our knowledge. So with question 1, we have, can you guys see my screen? Are we together?
Yes.
Okay. So question one
Yes, we can see your
states,
screen.
yes, so it states, explain the primary nursing action required before administering a high alert medication and the rationale behind it. The primary nursing action required in administering high alert medication. Guys, what did we say is the primary nursing action in administering high medication, a high alert medication? Guys, are we together?
Yes, we are together. I'm sorry, I joined the class late, so I was not there when you were taking the class. But
Oh,
primary nursing action should be maybe taking history about the medication, um, checking the drugs, if it's the right drug, expiry date, right dosage, and everything, and primary vital signs.
okay, that's correct. These are all nursing assessments that are supposed to be carried out before administering any medication. Okay. But then when you're talking about a high alert medication, a medication that if it's not monitored or if there's a slim chance of medication error, it will be devastating. That's why we say high alert medication, right? So in cases like that, what do? You need to verify independently with another nurse. Verify the order, right? Another nurse with every other thing you have stated there, like the 5 hours of medication administration. Another nurse independently should verify it, re-verify it before administration, right? To prevent any medication error. Remember, high alert medications, they are medications which we are trying as much as we can not to have an error, because any error with it is very, very fatal. Okay? Are we okay on that?
Okay, sir.
Okay. So question 2, it says describe the main purpose of the Canadian medication incident reporting and prevention system. What is the main purpose of incident report?
To prevent further reoccurrence or for documentation purposes, and to further help in research on how to help for the for a better production of the efficacy of the drug.
Good. Like you said, it's very, very essential to ensure safety and prevent further occurrence. Okay. Like we said earlier, if you notice there's a medication error, what do? First, to assess the patient, right? What is this error causing? What is this medication error causing? What is this administration error causing? Now you document it. Okay, this will help in the future to know if a medication is administered wrongly through the wrong route. This is the potential fatal effect, right? So incident reporting is not it's not put or meant to harm you or to penalize you. It's just to improve safety of practice. Okay. Now question 3. So what is a medication's half-life, and how does this concept influence medication dosing schedules? Medications half-life and dosing. What do we understand by the medications half-life?
Uh, I lecture
Sorry,
earlier.
I can't
But
hear you properly.
medication, I said, I'm sorry, I came late to join the class. So
Oh,
I
okay,
was not
okay.
there
Let me
when you were
just,
doing it. But medication half-life means the expected time that the medication has to be very effective if taken. As in, it's actually written for all medication from the pharmaceutical company. So a medication have a specific time that it will be very effective, and that's the half-life of a medication. So the concept
okay,
of which how it's medication dosing schedule, as the half-life declines, then the dosing should be increased so that it can be more effective for the purpose of the drug.
okay. That's a good point. Like you said earlier, medications half-life is the time it takes for the body to eliminate 50%, right, of that medication in the body. So if 50% of a medication is being eliminated, we need to, what do we need to do? Like you said earlier, we up the dose, right? Or we administer again to maintain the potency or the medication at a therapeutic dose or rate, right?
All right, sir.
Yes. Like I gave another example. Like if you have a medication and the half life is 2 hours, right? So after 2 hours, 50% of that medication is eliminated from the body already. So what do? You need to maintain you need to maintain a steady state or a steady concentration of that medication in the body. So another dose is scheduled after that, right? That's why we have with the dosing schedules. We have dosing schedules like uh, after 2 hours, after 4 hours, after 8 hours, after 16 hours. Those are all aspect thanks to half life. Like all the dosing, it's been calculated or programmed based on the medication's half life. Okay. Now let's look at question 4. What are the priority assessments a nurse must perform before administering an opioid analgesics like morphine sulfate, and why are they essential?
I think this one I can answer is to get to know the baseline vitals. For example, the respiration rate. So when you get to know the baseline for respiration rate, you'll be able to understand when the patient is going to respiratory depression.
Okay. Like you made mention, first you check for respiration, right? Check
Yeah,
for respiration. Good.
yes, assessing the respiration rate. Yeah.
Yes. Good.
Then you also talk about the level of consciousness.
Yes. Yeah. With level of consciousness, now that in the course of administration, right? Keep assessing. So question 5, you have explained the signs of digoxin toxicity and the crucial nursing assessment that must be completed before before administering this drug. Signs of digoxin toxicity. What did we say was a prominent sign of digoxin toxicity?
You said something to do with the halo sign.
Yes, the patient will report seeing halos around
Yes.
light.
Yeah, and then
Okay,
on the and then on the nursing assessment is trying to establish the baseline, like the heart rate for the patient before administration of the drug.
and what is the value? The value of the heart rate, the baseline value.
It shouldn't be less than 60.
Correct. It should be less than 60 before administration. So you count the apical pulse, right? And it should not be less than 60 before administration. And in pediatric clients, you count for a whole minute. So question 6, it says describe the most
Please, I
appropriate
have a question.
nursing response. Okay, yeah, go on.
I didn't get the value for the pediatrics.
It's still 60, but with the
Pediatric
pediatric
is
now,
okay.
yes, it should not, the heart rate should not be less than 60 before administration of digoxin. In any condition, it should not be less than 60. Now, for adult patients, you might count and you multiply. But with pediatric clients, you count for a whole minute. You stand there, you count, right? Pay attention, you count for the entire minute for accuracy. Okay?
So this week I think one of the questions they were asking the the rate the pulse for the infant before you withhold. I think I don't know. I think the answer was 80 or so. So I don't know if it's the pediatric you are talking, it's cut across or it's only
You're saying one of the questions for
one of the questions I think they sent to us was when you will you withhold in infant, and I think I chose 60 and I think I got it wrong. So I don't know.
which medication of
The Jobson.
which medication, sorry?
The Jobson. So I want to clarify whether in infants too is less than 60.
Less than 60? You count the heart rate,
Or maybe
right? For a full minute.
yes. I wanted to find out
Yes, you
whether
count
in
the heart rate.
infants is it less than 60 or the infants also have their value.
No, it's you count the heart rate for adults, right? If it's less than 60, you don't administer. And for infants, you count the heart rate for a full minute. It should be greater than 60.
Okay.
Okay. Yes. So question 6, is it describe the most appropriate nursing response if a patient refuses a prescribed medication and the ethical standard this action supports. The most appropriate nursing response.
Please the question again.
It states, describe the most appropriate nursing response if a patient refuses a prescribed medication and the ethical standards this action supports.
I think the patient has an autonomy to decide whether he wants
Okay.
particular treatment So if he refuses, I think you should respect patient's wishes and notify the provider.
You should what?
I think you should respect patient's wishes and notify the provider.
Good. Like you said, you respect the patient's autonomy, right? You document the refuser and you notify the provider. Okay. So now we look at question 7. So why is it critical for patients to complete the full prescribed course of antibiotics even if they begin to feel better?
Let me try.
So,
I think we want to avoid resistance to the antibiotics.
perfect. That's excellent. Completion of antibiotic regimen, right? It prevents antibiotic resistance. The bacteria will not develop resistance to the antibiotics, right? So even if the patient is feeling better, it's always important to complete the treatment, to completely wipe out the bacteria from the system, right? So question 8, what is the correct procedure for a nurse to follow after discovering a medication error has occurred? The correct procedure for a nurse to follow after discovering a medication error. What do you say was the first step after discovering a medication error? I just made mention of it earlier again. You assess the patient, right? You assess the patient for what the error is causing, like you have administered a medication through the wrong route, or you have given a wrong dose. What do you do? The first thing you check, assess the patient. What does this mistake cause, right? After assessing, what do? You document. After documenting, you complete the incident report, right? Are we together on that?
Yes.
Okay. So now let's look at question 9. It states, explain the key differences in absorption rate between IV route and the oral route. The key difference in absorption rate. We mentioned earlier at the beginning of the class when we were looking at the rate, when we were looking at the routes of administration, like IV routes, medication is directly introduced into the bloodstream, so it's being carried to the target sites, right? Where it exerts its effects already. It does not have to go through the GI tract or the liver for first pass effects, right? Meanwhile, with the oral route, you have to go to the GI tract, absorption at the different stages. You might have liquid medications that will be absorbed in a different state, and then you have enteric coated, which are designed for absorptions in the less acidic environments like the small intestine. So it delays the, like, with IV medications, you get to see the effects faster as compared to oral routes of administration, right?
Yes, you're right, sir.
Okay. So question 10, the last question. So what are the signs of hypoglycemia in the patient taking insulin? And what is the immediate nursing action? The signs of hypoglycemia in a patient taking insulin. The patient taking insulin, it means the patient is diabetic, right?
Yes.
Yes. So a diabetic patient, diabetes, another word of it, you have hyperglycemia, right? So how can
Yes.
hyperglycemic patient becomes hypoglycemic? It sounds contradictory, right? Why?
Possibly the
Because
person
I said
has.
earlier, over medication. It's one of the primary cause of hypoglycemia in diabetic patients,
Yes, sir.
right?
Yes.
So what are the signs you often observe? We said tremors,
Fainting.
sweating, and tremors,
Fainting.
right?
Yeah. Yes.
Yeah. And what is the immediate next action?
It gives easily the absorbed sugar, available
Correct.
sugar.
So I think that is it for today. Do we have some questions?
Sorry, Virginia. The sugar is it not for a patient that is conscious? What if the patient is unconscious? It can't be sugar, right?
If a patient is unconscious, you have
Yes.
there's extras, right? Yes, and or
Yes.
you give IM glucagon.
Okay.
Okay.
All right. Thanks.
If the patient is unconscious, you start an IV line, right? For dextrose. Do we have another question? Is there another concern we need to address?
Yes, the pharmacology PDF is not on our classroom platform.
Mm, okay,
The,
I
the
think I
lecture.
will have to discuss. Yes, I will discuss with the team on that, and it will be made available. I'm really sorry you guys were not having it before the class. I thought it was available. Okay.
Thank you.
Yeah. So that is it for today. If there's any worry, you guys can. I mean, you always feel free anytime to like send or address it through an email. I'll look into it. Okay.
All right. Thank you, sir.
Okay. See you guys same time next week.